Hello, these are Flip Notes 1.9 of the Unit 1 extension on the biological basis of behavior, and we'll be talking about sleep theories and sleep disorders. Let's get started.
But why do we sleep? Some different theories that our early ancestors needed to sleep because that was when they were most vulnerable. So, just kind of staying out of danger by going to sleep in a safe place. Sleep is important in recuperating the brain to help restore and repair it, helping with remembering, memory consolidation, purging of unimportant information, and then, of course, for growth. That is when those growth hormones are released. And let's get into some sleep disorders pretty quickly here. So, insomnia, probably have all heard of. Insomnia affects pretty large percentage of the population. It's not just that you can't fall asleep. Some people can fall asleep fine, but they have trouble staying asleep, or they have problem going back to sleep, or they're constantly waking up. The causes of it, researchers think it relates to having a more active autonomic nervous system. So it's kind of like their mind wants to stay in fight or and their body in fight or flight mode, which makes it a little bit harder to sleep. So for some reason, their physiological arousal levels are higher than average. It's more common with people who have anxiety. They're just not getting enough GABA. Their brain's releasing too much norepinephrine, but for some reason, their nervous system just is having a harder time relaxing. Narcolepsy is almost the opposite of insomnia. So rather than you can't fall asleep, the problem here is that you do fall asleep into REM sleep. So they're not just falling asleep for like a little light sleep, they fall all the way into REM sleep. It can last up to 15 minutes, but it's usually pretty quick. If they do fall all the way into REM sleep, that's called a sleep attack. But more often, it just shows up as overwhelming sleepiness. Affects about 1 in 2,000 people in the US. A lot of people think that it's underdiagnosed, that people who have this overwhelming sleepiness are narcoleptic, but they're not diagnosed. In Japan, it's something like 1 in 600. So that's why a lot of people think it's not diagnosed correctly here. Our next one is sleep apnea, which is a lot more common than narcolepsy. With sleep apnea, a person stops breathing as many as 500 times a night, or just hundreds of times a night. That they stop breathing due to an anatomical deformity or deformity, that something is pressing down on their airway. Often it's their own body weight, but it could be to sort of an odd formed nasal cavity. The risks that come along with sleep apnea, the main one is high blood pressure, but then all of the other effects that go with sleep deprivation. Because if you are constantly being woken up through the night, you're not making it into REM sleep and you're not getting the REM sleep. The main treatment is a CPAP machine, which they wear to help them breathe and gives a constant flow of air. A lot of people resist it because the machine can be kind of uncomfortable or loud, but the effects are great, the positive effects. And then the other way to treat it is by losing weight if it's because of being overweight. Usually, the way that doctors will identify sleep apnea is by the unique snore that happens. So it's not a consistent snore, it's a sudden, gasping, out of breath snore. That you're literally stopped breathing and your brain wakes you up so that you can breathe. And we'll listen to some examples of that in class. REM sleep behavior disorder, pretty rare, but occurs when people are not staying paralyzed when they're in REM sleep and they're actually trying to act out some of their dreams. Can be especially dangerous just because they're moving around. They could be flailing their arms, could hurt somebody, their partner that they may be sleeping with. It can involve sleepwalking and they can injure themselves. Seen more often in older men and is linked to Parkinson's disease as well. Night terrors, more common in children, but it can also be a side effect of PTSD. The person suddenly wakes up from sleep. They're feeling a physiological reaction with their heart rate up, sweating. Usually it happens in the first sleep cycle of the night, so earlier in the night, but it happens in deep sleep, so stage 3 or 4 of their first sleep cycle. Usually they don't remember what they were dreaming about because it's in that deep sleep. But they can tell that there was something scary that they were dreaming about. Sleepwalking, the formal name for sleepwalking is somnambulism. Person awakes and they kind of are moving around with a blank stare, kind of in an automatic manner. Sometimes they're just doing things you would do when you're awake, like you try to go eat. A lot of people try to use the bathroom and then they wake up when they feel the warmth of going to the bathroom, not in the bathroom. Also, often happens in stage 3, so they're super confused if they do wake up It's actually not dangerous. There's a myth that they'll die if you wake them up, and that's not true. In fact, you often do want to help them get back to bed so they don't walk around and hurt themselves. So sleepwalking and night terrors, both of those are happening later in the night, stage 3, stage 4. Nightmares, though, we do tend to remember those because they happen in REM sleep. So the difference between nightmares and night terrors, nightmares and REM sleep are often remembered. Night terrors are later in the sleep cycle in stage 3 or 4, and we often don't remember those. The final one is not really necessarily a sleep disorder, but we fit it in right here. And it's a super sad one, and it is SIDS, or sudden infant death syndrome. What happens here, basically, mom goes to check on baby in the middle of the night, and with no kind of symptoms or anything, the baby has just stopped breathing. And often it's happened early enough from when mom walked in there that they can't be resuscitated. Used to be called crib death, kills up to 3,500 kids a year. The number has gradually been going down. And for a long time, people really weren't sure what was happening or why crib or SIDS happens, why they stop breathing. They think there's some kind of immaturity or malfunction in the central nervous system, primarily that their brain is not switching over to automatic breathing when they fall asleep. It does seem to happen a little bit more in kids who are sick, who have an upper respiratory infection, or whose mothers did drugs while they were pregnant, which can affect their system as well. The main thing to combat it is monitoring babies and really making sure that they sleep on their back. That when they're on their back, there's nothing obstructing their airway. Problem is, lots of babies are way more comfortable sleeping on their stomach, and there are things, technology things that have been created to help with that. But back is best, is what moms are taught to and how to help their babies to sleep. Some percentages or statistics here showing that the SIDS rate, and this is only until 2010, but you can see has gradually gone down, but now it's kind of plateaued. But it went down as the mantra that back is best was really being promoted, that making sure your child is sleeping on their back where they can breathe. As that became way more common, SIDS has gone down.